that pops up to tell you we're live. There we go. Holy smokes, I can't believe it, y'all. It is Friday again. I guess that means it's been 7 days since we did this. That's crazy. It's absolutely crazy because here we are in the middle of July, which is the middle of the year, which means we're starting the third quarter of the year. Man, if anybody can teach me how to get time to slow down, that would be amazing. I would love that. So if you know how to do that, connect with me. Let me know what your secret is. I would like to slow down time a little bit. That would be awesome. But it is Friday. So let's kind of get to what we're doing here. Friday Friends, I am so excited. If you're new here, my name is Nicole Broadhurst. I'm a former healthcare administrator turned independent patient advocate, CEO at Tennessee Health Advocates, and founder of The Circle, where advocates surrounds patients with support. So that's a community for patient advocates, by patient advocates, to increase awareness around what we do and help us all remember why we do what we do. So that's what we do over there. If you're not a member of the Circle and you're an independent patient advocate, come join us. We have some fun. In the meantime, today on Fridays and Friday Friends, I love to share my friends with you. I hang around with some pretty fun and cool and unique people. And so I love to share them with you so that you can get to know them as well. Today is no exception. I'm joined today by my friend, Jenni Nolan, and I'm going to bring her on here.
Hey.
So Jenni and we were just trying to figure out how long we've known each other. And I think it's somewhere around 3-ish years, somewhere in there. What do you, does that sound about right, Jenni?
Everything to me is pre-COVID or post-COVID. And I'm going with maybe like a year post-COVID. So maybe it's like 2 years.
Okay, 2 years.
It wasn't pre-COVID.
No,
and that's
no,
how
I think you're right. You know, now that I think about it, I think you're right. I think that I think we knew of each other, but we actually connected. I think I was working in the oil field in Texas.
What?
Yeah. Oh, yeah. We'll have to talk about that.
I don't even know what that means. You were like,
so we were
oil?
So we worked on an oil field in Texas. This isn't supposed to be about me. This is supposed to be about you. So, but anyway, I remember that because I used to do Zoom calls in the bathroom of my RV, and I had a backdrop so that people didn't know that I was. Anyway.
Wow.
So I think you're right. I think that would have been like 2021.
I'm thinking
so. I think that, yeah. So you're right. Post-COVID. Good call. Good call. Glad we figured that out. I'm sure everyone wants to know.
I'm sure everybody's so intrigued by that.
I know. Just like they'd be intrigued to know that, we had tech snafus and, all of the good things. Yeah. Right. So Jenni and I connected mainly because Jenni's also a board certified patient advocate, an independent patient advocate, and we both specialize in medical billing and health insurance benefits and all of the things. And so, of course, we connected on all the things nerdy around medical bills and pricing and all of that. But specifically, I wanted to talk to Jenni today about, tell us about your practice. Like, who do you help? What do you do? How did you get to be like, how did you end up where you are? What's your story?
So my background is a little bit like yours, except that I've never worked on an oil field. And I did start out in like the administrative side of healthcare, managing physician offices. And that's where I kind of got obsessed with chasing the money down and making sure claims were processed correctly, patients were being billed appropriately, providers were being paid appropriately, and just became really obsessed with that whole system and how broken it is, and seeing like where all the errors are. I mean, there's so many opportunities for error from the moment a patient walks in the door and hands over their insurance card. Yeah. And then I started noticing that the medical bills that we receive here at our house, I've got a husband and 4 kids. So we don't have a ton of medical bills, but I would say a third of them are wrong when they come in. And I had retired from my practice management position, and was on like griping about a medical bill on Facebook one time. And people were like, you should start a business. And I was like, well, who's going to pay me to help with their medical bills? And I just got on the Google machine and I was like, oh my gosh, there's a thing called patient advocacy. I can actually do this. Woohoo. So that was like 2019. And then I got board certified and started my business. February 1st of 2020 was my official start date.
Nice.
Yeah.
And so how cool is that? So there's so many things that I want to like pull out of that. I want to specifically, I want to talk about, do you really get up and like get paid to do something that you really love to do? Is that what you just said?
I did. And I get to do it in my sweatpants. I got fancy for you today. I don't know if you can see this, but I have on a special sweatshirt today. It has eyelet on the sleeves and I have earrings on.
You do have earrings.
Yes, from the waist up, I actually look semi-professional, but I like my favorite part is making my own schedule. Wearing like the first thing I do in the morning is I work out and I've got my yoga pants on the rest of the day and I'm doing work that I actually love on my own schedule. I love all of it. Yeah.
Isn't that crazy?
Yeah.
I mean, really, like I wanted to make sure that I heard that correctly because I feel like this is one of the things that we talk about a lot inside the circle, right? Is that, when we start our practice as an independent patient advocate, it really is, the industry is so wide open that any value that we can bring to a patient is unique. And if that's what we love to do, then man, that really needs to be our passion, and we can do that. Like, so for me, I agree with you. Like, who's going to pay me to look at their bills? Like, what?
Yeah.
So, I mean, if we can find, a market for that, there's a market for just about anything, right? I mean, surely. So,
well, and it's such an opportunity because it's a new and emerging field, but everyone is a potential client. We are all patients. Not all of us are in the market for a truck. Not all of us want pizza for, like, everyone is a patient. So it's
it's
unlimited supply of potential clients.
Right. Exactly. And I don't know, we've been around a while, and I love, the other thing that I heard you say was all the opportunities for errors from the time we walked in.
Yeah.
And I just thought, wow, it took me back. Like, what's the if you had to like pick, what do you think is like the very, very first opportunity for error?
Well,
like,
I think
literally.
Well, I guess it could go even before an appointment is scheduled, right? Like a patient calls and says, do you take my insurance? And so things can go wonky right there. Especially with these new, I've had so many new clients lately who have like a Blue Cross plan or a Cigna plan, and they call somewhere and say, do you take Cigna? Well, the answer is, yeah, we do. Well, what the patient doesn't realize is they have this narrow network. They're in a special like HMO old school thing where that provider is not actually contracted.
Right.
And so it can kind of go south before it even starts. But then, you walk in and you hand your insurance card to the sweet front desk girl who is probably making a little more than minimum wage and doesn't really care if she updates your insurance information that day. Like, she's probably thinking about what she's doing after work, and it just
and it just compounds,
goes from there. And there's a million other places along the way. Bigger. Coding.
Right. No, I love your answer. The very first opportunity for an error is on the phone when we're scheduling the appointment. Like, I don't know that it can get any, Like that really is the first
Yeah.
opportunity. Truthfully though, right, in everyone's defense, those networks, right, there's these big carriers, UHC, Blue Cross, Aetna, Cigna, but inside of there, what you said is really important. The network that we have, there can be hundreds,
Yeah.
right? And that can be super specific. And on the provider side, and I know that you saw this too as a practice administrator, that as a provider in the office, I don't always know off the top of my head every single network inside of Cigna that we're a part of.
Correct. So you usually find out like almost by trial and error, like because, the physician practices I was working at were employed by a hospital. So it's the people up here that are doing the contracting. I don't
Right.
know. I mean, they hand down memos, but really you find out that you weren't in that HMO network when you send a claim and it bounces back. Sorry, dude, you're not actually part of this network. Yeah. And so,
Right.
so yeah.
Interesting.
So hard. It's so complex. Yeah.
It is. It really is so complex.
Yeah. And if
You know,
you
it's
and
interesting. Oh, go ahead.
other professionals can't, like, every day we're presented with a new thing that we're like, oh my gosh, how do we figure this out? So how do you expect the average patient to figure any of it out? Yeah.
Right. And being in the middle of a treatment protocol,
Oh yeah.
right? Like
Just trying to stay alive sometimes. Yeah.
right.
Yeah.
So not right, right?
Yeah.
Of all of the things that
But I
should
will
not
say,
be.
down that avenue, like those are some of my favorite patients to take on, are the ones that are battling like an illness like that and just need somebody to come alongside them and hold their hand and make sure things are being done properly so they can just focus on their health care.
Right. So they can focus on their physical health, on their life,
Mhm.
on their longevity, on their, ability to survive whatever chronic or, acute treatment plan that they're in.
Mhm.
So true, right? So true. Such a valuable service. I wish that I often say, I wish the world didn't need us.
True. Yes.
Right?
Same.
Wouldn't that
Yeah.
be a beautiful thing?
Yep.
So I love that as well. I love that as well. So do you have a favorite story that you like to share? A success?
I think, well, one of my favorite stories is that my very first client ever, like I had a huge success, like right off the bat with my first paid client. I mean, I obviously did this for like friends and family and people, under the radar for a long time. But then my first paid client was getting, I think it was like 60 some $1,000s in bills from some injections that he was having every month that were like 20K each. I don't know why the color on my, sorry.
It's okay.
Anyway, by the time he got like he'd already gone in for his third injection. By the time the bills caught up and said, oh, sorry, these aren't actually covered. So then he was like, okay, let's stop this. Meanwhile, I've got $60,000 in bills I need help with. And so I was able to do an appeal for him and get it totally taken care of. Like he just ended up owing his deductible and everything like he would have. But
wow.
so that was a fun story just because it was like my first one. And I was like, oh, this is good. Yeah. Yeah. Another one that I think is fun that I didn't even really have to do anything, but I love to tell the story because it's ridiculous, was a gal who reached out to me from Texas whose husband had his original charges for a COVID stay were about $593,000. And they had, their only insurance was this hospital indemnity plan that promised to pay $100,000, and they did. So the patient was left with a $493,000 balance. And when they called the hospital to say, we can't pay this, the hospital very kindly offered them a 3-year payment plan at $13,000 a month. That was their solution to the problem. And she was like, I can't pay $13,000 a month. So she reached out to me and I said, well, I Googled the hospital, found their financial assistance thing, sent her the link. I was like, have you filled this out yet? She told me what her income was. And so she actually hired me to help, but then I gave her money back because she filled out the application and got the bill down to like $12,000
Nice.
that she could then divide over 36 months. So yeah.
Much more manageable, right?
Yeah. So sometimes people don't actually really need us to dive in. They just need someone to point them in the right direction. And that was what I was able to do with her. And yeah.
I love that. So that's really important. That I think what you just said is something that I want to make sure that listeners and viewers hear, right? Is that many times we field phone calls and questions and talk to people who, don't necessarily need to engage our services. But I love what you just said. They just need some support and guidance. Like, how many times have I or you had that conversation where we're like, oh no, just you're doing the right things. Just keep doing that thing and be patient. Speaking of which, I know that there's a woman in my database that I need to call today because she was battling some bills with her son and she was doing a bang up job. I was like, you're a rock star. Keep doing what you're doing. But I want to find out if she ever got him finished. So I'm going to look her up and give her a call this afternoon. So I think what I want to say is don't be afraid to reach out and to connect with an advocate, even if you don't think you're going to engage the services, right? Even if you think that you just want to make sure that you're doing the things that need to be done and you're on the right track. Because the truth is, and I'm sure you can attest to this, Jenni, that really outside of that, the system's not going to validate you that you're doing the right thing, right?
Right.
Like it's going to feel like you're doing the wrong thing.
Yeah. Or people expect things to happen quickly and they just don't. But then on the flip side of that too, I think from an advocate's perspective, don't be stingy helping these people along, even if you know that they're probably not going to sign with you or they're not going to sign with you right then. Help them out. And I tell you what, I have had so many people 6 months later who have tried. They're like, okay, thank you for the help. I'm going to go try to do this on my own. But 6 months later, they reach back out and they're like, I so appreciate all the guidance you gave me, but I'm ready to hand it off. Like,
right. Yeah.
And then they hire you. So don't be stingy. Yeah.
I love that, Jenni, because I'll tell you, my biggest raving fans, the people who love me and are singing my praises and sending me referrals all day long, are people that have never been clients for me.
Yeah.
Most of them are the people that you're talking about, that I just gave them the support and guidance. And, they were able to take that information and go do it themselves. And as a result, so, raving fans are super important, right? Yep. So I love it. Jenni, I'm so glad that you joined me today. This is just fun because it feels like we could hang out for a long time, but I don't want to bore the viewers.
Yeah.
So I think we're going to go ahead and wrap it up. I do want to give you the opportunity though. So if people are listening and hearing something that they really like and they want to connect with you, where do they do that? How do they connect with you?
They can find me all over the place. ClearHealthcareAdvocacy.com is my website. I'm on LinkedIn and Instagram and Facebook under Clear Healthcare Advocacy.
Clear Healthcare Advocacy.
It's a mouthful, but yep, that's where you find me.
That's okay. And if you follow me, Jenni and I are connected. So if all else fails, you'll find her on my connections or my friends or all of the things. We're connected. We hang out a lot. So yeah, connect with her. And listen, if you're an advocate and you're interested in learning more about how to build a profitable and sustainable practice, make sure that you go join us in the circle where we have resources and tools and community that will support you as you grow your business. And you can do that at thepowerfulpatient.com. It's scrolling across the bottom. So until next Friday with another friend, we'll see you later. Bye, guys.
Bye.